Hello and welcome to Wellness with Delaney. I am sitting down with Dr. Nathan Bryan today. He's a nitric oxide scientist, an inventor, an author, and has so much to say about your health, wellness, and longevity. Dr. Nathan, thank you so much for joining.
Delaney, great to be with you. Thanks for having me.
I am so excited for this chat. So, I didn't even realize that nitric oxide was such a big component in health, and I don't think a lot of people do either. So, what is nitric oxide and how does it work?
Yeah, look, it's a very important molecule. In fact, it's recognized as one of the most important molecules produced in the human body. But it's a gas that signals. It's how cells communicate in the body. It regulates blood flow and blood pressure, oxygen delivery. It mobilizes stem cells. It activates mitochondrial biogenesis, improves the efficiency of energy production inside the cell. Um, Yeah, so the science tells us that the loss of nitric oxide production in the human body is really one of the earliest events in the onset progression of chronic disease. So we have to be able to understand what this molecule is, maintain adequate production if we want to live a long, healthy life free of disease.
Well, yeah. So, why do we lose it as we age?
Well, there's a couple of things that happen. To answer that question, we had to first understand how the human body makes nitric oxide. And so there's an enzyme that's found in the lining of the blood vessels. And what we're finding is that the older we get, the less functional that enzyme becomes. And that's due to a number of things. Number one, a Western diet, exposure to toxins, nutrient deficiencies, high carbohydrate, high sugar diet. And then there's some genetic predispositions that cause endothelial dysfunction. So that's number one. But today we understand that, even though we see this age-related loss of nitric oxide in the general population, we know how to prevent or at least delay that age-related loss of nitric oxide production. And really that's the goal. And then the
Mhm.
other thing is, the foods we eat, whether it's, there's data now showing that the food grown in America since 1946, since the 1940s, there's about a 76% depletion of all major micronutrients in the food we eat. So it's nutrient deficiency, it's exposure to toxins, it's really oral hygienic practices. Fluoride in the drinking water, fluoride in the toothpaste kills the oral microbiome. 2 out of 3 Americans use antiseptic mouthwash every day. 200 million prescriptions written for antibiotics every year. And then common drug therapy, antacids, proton pump inhibitors, cholesterol lowering medication. All of these deplete the body's ability to produce nitric oxide.
Wow. Okay. A lot to get into. And I think with a lot of these issues, seems like there are also like a lot of solutions that I'm really excited to talk about with you. And I know you have a lot of great solutions. So I would love to kind of dig into that diet component. So you were saying sugar and carbs. Are you a proponent for the ketogenic diet?
I think diets have to be personalized. I think it's very difficult to prescribe a one size fits all for every person at different stages of their life. I think the data on ketogenic for weight loss and kind of wellness looks pretty good. On the other hand, on the other extreme, people with really advanced coronary artery disease and atherosclerosis going on a plant-based diet, there's very convincing data that you can reverse and regress cardiovascular disease on a plant-based diet. So I think what works for me is a straight ketogenic, not straight carnivore, but really high protein, good fats, very little carbs. Because what we're finding is anything that leads to an increase in blood sugar, right? And continuous glucose monitors are available everywhere. And so you have to figure out what works for you, how your body and can metabolize sugar and carbs. If you're a well-trained athlete and you need it for fuel and you burn it, that's good. But most people aren't, and they need to avoid sugar and carbs because here's what we're finding. An elevation in blood sugar, or what we call blood glucose, if sugar is sticky, right? Glucose is glue, and it sticks to proteins, it sticks to enzymes, and it glues everything together. And in biochemistry and enzymology, enzymes have to be able to undergo conformational changes. So when there's excess sugar in the circulation or in the cell, it sticks these proteins together. In fact, it sticks to hemoglobin. And we measure this as hemoglobin A1C. So it's the amount of sugar bound to hemoglobin. But sugar binds to the enzyme that makes nitric oxide, shuts down nitric oxide production. And it makes your blood cells sticky and clingy and sticks to the lining of the blood vessels and induces vascular inflammation. So that's one. You have to figure out what works for you. And the best way to do this is continuous glucose monitoring. to figure out if you can eat simple carbs and not lead to a chronic elevation of blood sugar and oversecretion of insulin, then maybe that works for you. But most people who aren't active, who are sedentary, must avoid sugar and simple carbs and supplements that contain sugar.
Yeah, absolutely. And you know what's so interesting? I feel like there's been this like common theme in a lot of the interviews, especially with doctors, talking about like so much more research coming out around sugar and carbs. And I know we've kind of come out of an era where it was low fat, low fat, low fat, eat these carbohydrate, sugar-free, fat-free, 100-calorie packs, right? Like that's what I grew up in. And it's been really, really interesting to see this change and this swing to full fat, lower carb. And I've really adopted that in my own life. And I've seen massive effects as somebody who is highly active. It has been impactful for my health in so many ways, in my energy, my skin, my hormones. It's pretty crazy. And then I know you mentioned so the minerals are really, really deplete. And there are obviously a lot of causes for that. Are you a proponent of remineralizing food, or are you looking for those like regenerative farmed like produce? Like how do you bring those minerals back into your food?
Well, I think we have to supplement. I mean, you have to figure out what you're deficient in. The only way to do this is get micronutrient analysis and testing for individuals to figure out, what are you deficient in? And if you're deficient in something, you have to supplement it back. But if you look broadly at the NHANES study, for example, it's known that 75% of Americans are deficient in magnesium. I mean, magnesium is an essential cofactor in, I think, over 800 biochemical reactions. 95% of Americans are deficient in iodine, chromium, selenium. I mean, these trace minerals that everybody's deficient in. So number one, you have to remineralize and you have to supplement what's missing in your body based on your diet and where you live. But I'm also a big proponent of, regenerative agriculture and growing foods that are nutrient dense. And, I'm very fortunate and blessed to have 800 or 900 acres where we raise our own beef, we grow our own vegetables. And so I do soil samples. I know what the soil's missing and I replete it back before I grow the food. So we grow nutrient dense foods. But, people who live in an urban area perhaps may not be afforded those same opportunities where they can grow their own food. But I think it's something that we can do better, and big agriculture, can do better as well. But it's, the pressures of feeding a growing planet population is at the expense of quality food and nutrient dense food.
1000%. And even like living in an urban environment, I live in an urban environment, and I think you're living my dream right now of growing all my own food. That's the goal. But I actually am this week getting a beef box from a regenerative farm that I'm going to start doing a subscription with. And I'm super excited. And so there are definitely options out there, even if you live far away. It obviously is an investment, but I always see like, do I want to spend all my money on a shelf full of supplements, or do I want to spend my money on food, which is food is medicine. So then with all of this into the nitric oxide component. So nitric oxide, as I learned from your page, won a Nobel Prize in 1998 for cardiovascular health. I would love to know how it supports the heart.
When we look at the cardiovascular system kind of as a system, right, it includes the heart and the millions of miles or thousands of miles of blood vessels throughout the entire body. So nitric oxide is what we call a vasodilator. So when the endothelium, so there's a single layer of cells that line all blood vessels, and it's called the endothelial cells. And these cells are responsive to changes in their environment. So for instance, if we want to start to exercise and we get on a treadmill, so we have to be able to dilate the blood vessels of the coronary arteries of the heart to improve oxygen delivery and to meet the increased metabolic demands on the heart. And then we have to dilate the blood vessels of the skeletal muscle to improve oxygen delivery. So because we need more energy to maintain that type of activity. So when you have healthy endothelium, it produces nitric oxide, it dilates the blood vessels. So we're improving the efficiency of oxygen utilization and oxygen delivery. And it also improves mitochondrial function. So now we're generating more cellular energy more efficiently with less oxygen. So that's number one. And then at certain doses and physiological concentrations of nitric oxide, it's what we call a positive ionotrope. So it's improving the contractility of the heart. So now you're ejecting more blood with per beat. So the pump function of the heart is improved. So nitric oxide is not only improving the pump function of the heart, but the plumbing function of the heart to dilate blood vessels. And so what we're finding is that if you become compromised in your ability to produce nitric oxide, it leads to things like erectile dysfunction, because if you can't dilate the blood vessels of the sex organs, you don't get engorgement. And it leads to systemic hypertension, so high blood pressure. Because when you think about this, we solve the physics problems of hypertension, because we all have a finite amount of blood pumping through all these pipes and blood vessels. And if you can't make nitric oxide, your blood vessels are chronically constricted. So now you have the same volume of blood going through smaller pipes and pressure increases. That's just basic physics. If we can restore the production of nitric oxide, we dilate the blood vessels. Now we can normalize blood pressure, and high blood pressure is the number one risk factor for the number one killer of men and women worldwide, which is cardiovascular disease. So nitric oxide is foundational for everything we know about cardiovascular health and support.
That is incredible. So then with that, is it also going to really benefit like athletic function?
No, without a doubt. I mean, these performance enhancing effects of nitric oxide is probably one of the most recognized ergogenic aids in performance. And that's why, most professional athletes, teams, individual sports are using, obviously they're using our nitric oxide product technology, because our products produce nitric oxide. If your body can't make it, we do it for you. But we're improving the body's ability to make nitric oxide on its own. So it's improving the efficiency of oxygen utilization. It induces mitochondrial biogenesis. So if you have adequate nitric oxide production, you have more mitochondria per cell that are generating more energy more efficiently, even with less oxygen. And that's why athletes love nitric oxide, because it's really the difference between first and last.
Amazing. Yeah, I definitely am like, wait, I need to try this. I'm not an athlete, but I grew up in the competitive dance world and I'm still highly,
Mhm.
highly active. And I'm like, wait, this sounds like a miracle. So then with that, what role does the mitochondria play into overall energy and performance?
Well, the mitochondria are the energy producing organelles of every cell. Every cell except the red blood cell has mitochondria, and that provides the energy for those cells to do their jobs. And so we know in people with age-related chronic disease, no matter what disease it is, there's always less mitochondria per cell, and the mitochondria that are there aren't efficient. The electron transport chain of the mitochondria become uncoupled, and now you get electron leakage, you get oxidative stress, you get superoxide production, and it's just a very inefficient system. So what nitric oxide does is induces mitochondrial biogenesis and improves the efficiency of oxygen utilization to make cellular energy. And that's really why it's a very important and critical metabolic factor, nitric oxide, so that your body can make cellular energy, so that each cell in the body has the currency to do its job. And without it, cells fail and tissues fail, and we develop end organ disease, and people get sick and die. It's really that simple.
What I love about this conversation is I feel like everybody in middle school and high school science gets so annoyed about hearing about the mitochondria and how it's the powerhouse of the cell, you know? And getting older and interviewing so many experts like yourself, the mitochondria comes up all the time. And it turns out it's really not something that we just need to like memorize and forget, right? And I think a lot of people have treated it like that growing up, especially my generation now being in like 20s and 30s. It's actually so important, and the younger we can recognize that, I feel like the better. And then so with the nitric oxide being so big on performance and heart and utilizing oxygen, right? I'm a big proponent of like mouth taping and facial exercise to practice nose breathing. Is this something that you see a lot of profit in when it comes to nitric oxide production?
Yeah, because we now understand the mechanism of nasal breathing and how it's been. So we always start with observations, right? So there's clinical data showing people who do deep breathing, nasal breathing, can actually lower systemic blood pressure, and that's a nitric oxide related phenomenon. So as I mentioned earlier, there's an enzyme found in the endothelial cells. These are the cells that line all blood vessels. We also have epithelial cells, and these are the cells that line the airways, the nasal sinuses, the pulmonary, the bronchial airway. And so this same enzyme, nitric oxide synthase, is found in our epithelial cells. So when we do nasal breathing, it activates these mechanoreceptors to tell those epithelial cells, I need nitric oxide. So when we do nasal breathing, it activates nitric oxide production. Nitric oxide's a gas, so it's delivered into the lower airways. We can dilate the smooth muscle of the bronchioles, improve oxygen delivery, and really improve perfusion to the lungs. And we can what's called match ventilation to perfusion and improve oxygen uptake, improve oxygen delivery. Now, there's a couple of problems here. Number one, people who aren't doing nasal breathing, who are mouth breathers, bypass this nitric oxide production pathway. But perhaps even more damaging is when they're doing mouth breathing, they're completely changing the environment of the oral cavity. Their saliva becomes acidic. They change the microbiome to a more opportunistic pathogenic phenotype, and it decreases the diversity of the oral microbiome, because the mouth is not used for breathing. It's not designed for breathing. And people who breathe it completely change everything about the ecology, and it shuts down nitric oxide production. So not only are we bypassing a nitric oxide production pathway through nasal breathing, we're inhibiting a critical nitric oxide production pathway in the oral cavity. And so I'm a big proponent of or advocate of nasal breathing. But the consideration is you should go see an airway sleep specialist to make sure that you don't have an obstructive airway, because if you tape your mouth and you've got an obstruction in the trachea, or your geometry of your mouth isn't sufficient, it could lead to hypoxia. So this is something we should be taken very seriously. And there's appliances, they're really good experts and dentists that specialize in sleep medicine can open up the airway, so now you can mouth tape and get full oxygenation through nasal breathing.
That's really, really fascinating. And actually, I know that you have products for oral health as well. So I'd love to dig into that. So, how do we bring back? So, if somebody does have an inhibited oral microbiome from their lifestyle, from mouth breathing, etc., like how do we bring it back and nurture that microbiome?
Well, it's a simple question, but not always a simple answer. And so the first thing I do is tell people, go get a full, oral exam. And most dentists, conventional dentists, don't know anything about this, right? It's not taught in dental school. So I always refer people to what's called biological dentists. And these are people who understand kind of the oral microbiome, the dangers of root canal, the dangers of mercury amalgam fillings, and to support the oral microbiome. So there's a couple of organizations that I recommend. One's called the International Academy of Biological Dentistry and Medicine, or IABDM.org. And there's an International Association of Mercury Toxicology, IOAMT, Oral Medicine and Toxicology, IOAMT.org. So these dentists can go in and do a CT and find asymptomatic dental infections that other dentists through X-ray wouldn't recognize. But then also change your oral hygienic practices. Most everybody, at least in the US, is using a toothpaste that has fluoride in it. And fluoride is an antiseptic. It's a neurotoxin. It shuts down your thyroid function. So number one, you have to get rid of fluoride in your toothpaste. Number two, 73% of the municipalities in the US add fluoride to the drinking water. So we're getting it in the water we drink, we cook in, we bathe in. I mean, it's awful. Now I think there's obviously a movement through Bobby Kennedy to eliminate fluoride in the drinking water, and I think that's going to be a huge, major step forward for the health of Americans.
Mm-hmm.
And then the other thing is, 2 out of 3 Americans use mouthwash every day, an antiseptic mouthwash. And when you see the commercials on TV that this kills 99.99% of the bacteria in your mouth, believe it, that's true. Remarkably, that's a very bad idea to kill 99.99% of the bacteria in your mouth. And I think the analogy I use is there's no physician or healthcare practitioner in the world today that would recommend anyone take an antibiotic every day for the rest of your life. Right? Because we know it causes systemic disease. It kills the gut microbiome and it's causing systemic disease. Well, antiseptics do the same thing. Fluoride does the same thing. Every day it's killing the bacteria in your mouth and it's leading to systemic disease. So we got to stop doing the things that disrupt nitric oxide production. Now start doing the things that promote it. And we're seeing remarkable effects by people adopting these very simple strategies. Get rid of fluoride in your toothpaste. Stop using mouthwash. If you're taking antacids, get off antacids. Eliminate sugar and simple carbs from your diet. 20, 30 minutes of exercise a day. 20, 30 minutes of direct sunlight a day. And their life changes. I mean, it's amazing. And now you can get people off prescription medication for the first time in the history of Western medicine. and the body heals itself. The body's regenerative by nature. We give the body what it needs, eliminate from the body what it doesn't need, and the body heals itself.
I love how simple the formula is. I think we make it sound so complicated as a society to be healthy, but it's actually quite simple. And it seems like it's mostly just like stripping away a lot of the garbage that we've added to society in the past few decades. Okay, so something I mean, I am very much fluoride free. I mean,
Good for you.
as far as I can be, right? And so I'm trying to even be good about like washing my produce in filtered water and all these things, right? Because I'm like, wait, I'm buying all this organic produce and then I'm washing it in the sink and getting all this birth control and fluoride and heavy metals and whatever, right? Like added back into it. So does fluoride actually calcify the pineal gland?
Look, everything it's a dose dependent effect,
Mm,
right? So I think if we look back, 100 years ago, for example, when this oral systemic link first was recognized, and there's translocation of oral bacteria in the systemic circulation, causing increased risk of heart attack and stroke. So the therapeutic strategy then, well, let's put fluoride in the drinking water. Let's put fluoride in toothpaste. And there was two considerations. Number one, the antiseptic effects. But number two, there was early data showing that fluoride could help remineralize the teeth and prevent the bacteria that causes caries or cavities. But again, that's a dose-dependent effect. And I think if we only had there, and I say maybe, there may be a slight benefit in remineralization of teeth. But now, even the high courts in the U.S. have ruled that fluoride in the drinking water, fluoride in the toothpaste, fluoride in antiseptic mouth rinse poses an unreasonable risk to the population, especially kids. There's data from the National Toxicology Program published late last year showing that fluoride exposure lowers IQ in kids, in some instances by 7 points. I
wow.
mean, so now what we have to do, look at the risk benefit. So I think the preponderance of evidence shows there's really no benefit of fluoride. It doesn't really show any improvement in remineralization of teeth, which was the primary reason for doing it. 100 years ago, we didn't know that a microbiome existed in the human body. And so there was no risk of destroying the microbiome. Today, we know, okay, there's no benefit and it's all risk. So when you look at it through a risk benefit analysis, if there's no benefit to it and it's all risk, then it's a very easy quotient, right? You eliminate it. You eliminate it from toothpaste, you eliminate it from mouth rinse, you eliminate it from the drinking water because we're overexposed. And I think we have a de-evolution of humans. IQs are lowering. I mean, it's awful. So you have to eliminate fluoride. And I think we're finally getting the attention of the American Dental Association. The data are undeniable. Lowering IQ, shutting down thyroid function, it's an antiseptic, and it's wreaking havoc on our health. And all you have to do is look around. And you made a point earlier that you growing up in this society where it's recommended eat carbs, eat grains, eliminate fat, red meat. All you have to do is look around. You see the consequences of this experiment that's gone horribly wrong.
Mhm.
9 out of 10 Americans are metabolically unfit. 2 out of 3 Americans are overweight or obese. It's awful. The data are undeniable that what we've been doing for the past 50 years is horribly wrong. And in fact, it should completely be opposite. Good quality protein, good quality fats, and little or no carbs whatsoever.
I am so glad that we're addressing this too, because, sometimes like being a health coach and a content creator, when I say some of this stuff, people are like, well, you're not an MD, so like, shut up? And so I love when I can get a doctor on here who knows their stuff, who has those credentials. And I'm like, thank you. This is so important. So I know people who are doing fluoride free with their kids, and I hear of them using hydroxyapatite as like a replacement. Can you tell me a little bit about that? Like, is that something you recommend?
It is. In fact, we just launched a nitric oxide friendly toothpaste where we're using it's hydroxyapatite base, right? So these are natural kind of compounds. Nothing we put in our toothpaste is from the hydroxyapatite is synthetic. These are naturally mined, but it remineralizes the teeth. So obviously for oral care, and look, oral care is extremely important because systemic health starts in the mouth. If we don't have good oral hygiene, there's data showing that you have increased risk of heart attack, stroke, and all-cause mortality as for cardiovascular-related illnesses. So number one, we have to remineralize the teeth, prevent cavities, but also support the microbiome. Because what we're finding is that if we destroy the microbiome, it allows for these opportunistic pathogenic caries-causing bacteria, the one that causes periodontal disease, gingivitis, to overpopulate. And so the microbiome are kind of like the police force, right? So the good bacteria police the bad guys. But if we're going in and we're killing all the cops, that leads chaos, and the opportunistic bacteria come in, changes the ecology, changes the pH, lowers the pH of the saliva, and now you create a completely different environment that only allows for the pathogenic bacteria, the opportunistic bacteria, and it destroys the ecology of the non-pathogenic commensals. So when we launch this toothpaste, I want to do two things. Number one, remineralize the teeth, kill the pathogenic opportunistic bacteria, restore the ecology, and create an environment in the saliva and the oral cavity that allows for the repopulation of the non-pathogenic commensal bacteria. So number one, it's fluoride free, which is very important. But number two, it's doing something that no other toothpaste on the market, at least that I could find, has addressed. We have a very simple metric. We want to optimize nitric oxide production in the human body. And we have to do this at every stage of kind of intervention. Oral hygiene, systemic circulation, elimination of things that are inhibiting nitric oxide production, and then giving the body what it needs to optimize nitric oxide production. So we have prebiotics in the toothpaste, hydroxyapatite, fluoride-free, but yet leaving the breath and the mouth clean, kind of a silky feeling that allows for an environment for the good bacteria to repopulate.
Oh, I'm so interested in this. This sounds amazing. So then since you're supporting the oral microbiome instead of stripping, because like I think about when people, let's say they have a wrecked microbiome in their gut and they might have acne and you're missing that good bacteria, the bad bacteria might be overgrowing, right? With the mouth, is it kind of the same? Like when you're missing the good bacteria, does that lead to stinky breath?
No, absolutely. So odor is caused by bacteria, right? Bacteria in the poop. I mean, you can people who have really odorous, fecal material, that's dysbiosis, right? Underarm odor is caused by dysbiosis. And the same thing with halitosis. It's the sulfur causing bacteria or sulfur producing bacteria that causes bad breath and halitosis. So what we have to focus on is restoring the ecology of the good bacteria, because most pathogenic opportunistic bacteria are sensitive to nitric oxide. And so what they do is they go in and hijack the system. They outcompete the nitric oxide producing bacteria to where they become immune to it. And so if we give nitric oxide or we restore the production of nitric oxide, then it kills the pathogens and it restores the production of the nitric oxide producing bacteria. So it completely changes the ecology. And we can do the same thing for the skin microbiome in the underarm, and we have to restore the ecology. And it's the same thing for, the vaginal flora is much different than the oral flora, is much different than the colonic flora, is much different than the skin microbiome. So these bacteria that are residing on different parts of our body are different because they're performing different functions, and we have to support it and not destroy it. And I think we have to get away from aluminum-based, antiperspirants and deodorants and start developing products that can restore the microbiome. Odor goes away no matter what part of the body the odor is coming from. If we can maintain a healthy microbiome, there is no odor. There's no bad breath odor. There's no underarm odor. There's no vaginal odor. The poop doesn't stink if you got a good, healthy colonic microbiome. It's remarkable.
That is so amazing. And I think people put on so many products, right? Like in order to not stink. And the stink really starts on the inside is what we're learning today. And that's so important. I mean, I feel like this is all biological feedback too, right? Like if you start to notice like, oh, I'm like really stinky these days,
That's your body telling you something, right?
Yeah. Like, okay, it's now time to start working on the health instead of just layering on yet another cosmetic. Okay, kind of shifting into neurodegenerative disorders like Alzheimer's. I saw from your platform and what you're sharing that nitric oxide can also be extremely beneficial for Alzheimer's. How does it support brain health?
Look, I think nitric oxide is the cure for Alzheimer's and dementia. And I don't say that lightly because that's what the data are telling us. So when you look at any neurological disease, neurodegenerative disease, let's say, there's always four kind of hallmarks or common denominators. Number one, if you look at cerebral blood flow or blood flow to the brain, you can do this through SPECT scans or functional MRIs. There's always what we call focal ischemia. What that means is there's parts of the brain that aren't getting adequate blood supply, so it becomes hypoxic. So number one, there's loss of regulation of blood flow. Number two, especially in dementia and Alzheimer's, there's insulin resistance. In fact, you've probably heard dementia and Alzheimer's be called diabetes type 3, because Alzheimer's dementia is a metabolic disease characterized by decreased blood flow and insulin resistance. And then as a consequence of that, you get inflammation, oxidative stress, and immune dysfunction. So those are the 5 hallmarks of dementia and Alzheimer's. And so this all starts with a loss of nitric oxide production, because if you can't make nitric oxide, you can't dilate the blood vessels, either the conduit arteries or the small blood vessels, so parts of the brain become hypoxic or ischemic. Number two, nitric oxide is required to get insulin into the cell. It's part of insulin signaling. So again, if the cell can't make nitric oxide, you develop insulin resistance. Nitric oxide is part of our anti-inflammatory response. In fact, several of my patents are on a method of reducing inflammation with nitric oxide. And then we talked about oxidative stress and the immune dysfunction. Nitric oxide completely mitigates those. So if you lose the ability to make nitric oxide, you lose regulation of blood flow to the brain, you get insulin resistance, you get inflammation, oxidative stress, and immune dysfunction. Proteins misfold, and we call that amyloid plaque in the tau tangles. So what we're finding is if we can start to restore nitric oxide production or deliver nitric oxide in the form of a therapy, we can improve cerebral blood flow, we can improve insulin signaling and glucose uptake, and inflammation, oxidative stress, and immune dysfunction go away. We no longer get protein misfolding, and that cures Alzheimer's. In fact, through my drug company, Bryan Therapeutics, we're developing a nitric oxide-based therapy specifically for Alzheimer's. And the early data show remarkable effects, improving cognition, improving cerebral blood flow. And I truly believe this is going to reverse and cure Alzheimer's. It'll be the solution for Alzheimer's.
Wow, that's big. Not just preventing, but like reversing and curing. Do you believe it'll be the same for dementia as well?
Well, dementia is what we call the early forms of Alzheimer's, to where it's there's a progression of disease, right? When you start to develop some decline, we call it mild cognitive impairment, or MCI. And then if not corrected, then it develops into what's called vascular dementia. And then if not corrected, it's diagnosable as Alzheimer's disease, which you can verify on imaging and cognitive exams. So our challenge in designing drug studies, and the success or failure of any drug, no matter what the target is how you design the clinical trial and what patients you enroll at what stage. So what we're trying to do is enroll patients that are far enough along to where they have an early Alzheimer's diagnosis, because the primary goal would be to prevent or slow the progression of disease. The ultimate goal would be see regression of disease. So we want to find patients that are far enough into the process where we can show that we can slow progression, but more importantly, show that we can regress disease and they get better. And so that's our challenge now, is finding that right patient population to enroll in the clinical study, to get the FDA approval, to where if we show these endpoints and show the progression and the regression of disease, that we can get an approval for that. And it'll be, I think, the solution for Alzheimer's. Because the challenge has been every drug company, despite billions and billions and billions of dollars on development and developing drug therapies against the amyloid plaque and the tau tangles, they've all failed. And to me, that's not surprising. That was predictable. I could have predicted this 15 years ago, because the amyloid plaque and the tau tangles do not cause disease. They are the consequence of the metabolic and vascular components of the disease. If you address the root cause, metabolic disease, focal ischemia with nitric oxide, you don't get protein misfolding. And those are the consequences of disease, and they shouldn't be drug targets. And in fact, it's a multi-billion-dollar bet that was lost, and tons of billions of dollars of money completely wasted, which it was very predictable.
Yeah. Wow. This is a topic that's really close to my heart as well. And I think this could be so groundbreaking and so amazing for so many people. So last year, I actually haven't really shared this at all on my page, because I try to keep it like not about my personal life. It's really about health, right? But I actually lost my grandpa. He was diagnosed with dementia several years ago, and it progressed to Alzheimer's. And he passed away last around Thanksgiving. And the last time I saw him was 2 weeks before, which I was really blessed. That I just felt this call. I'm like, I think it was from God, because I felt this like, you need to go visit your grandparents. And then 2 weeks later, he passed. But he didn't. I mean, of course, he didn't remember who I was at all. There were moments where he just seemed happy to all be together, but he wasn't present. He couldn't conversate. He didn't really remember anyone except for my grandma. And I'm thinking, like, if there was something like this out there, how amazing it would have been. Yes, he was aging and would have passed away probably soon, but he spent so many, of his last years not remembering his children, his grandchildren, going outside and wandering and getting lost in the middle of the night, that kind of stuff. And I'm like, man, something like what you're doing could have been so incredible for my family, and just like the heartache that caused. So now I'm like, wait, for people in the future. I mean, I would love for people to not have their grandparents and their parents go through this neurodegenerative disorder, and how hard it is on the family. Like, what you're doing could really change lives. That's
Yeah.
incredible.
No, it's tragic. It's the most feared disease in America, if not the world, because it's not the burden on the patient. They just don't know, right?
Mhm.
And we don't know what they feel because they don't communicate, can't communicate. But it's the burden on the family. And it's, look, we're all mortal beings, right? Nobody gets out alive. But our hope is that we live the longest life free of disease as long as we can, not only improving and extending our lifespan, but our health span. And that's the goal of what we're doing. We understand the mechanism of chronic disease, and we understand how to get to the root cause of this. And it takes, medicine is reactive in the US. People don't take action until there's a crisis or a health event, and then they want to change. So I think the beauty of these conversations is we want to promote people being proactive. And when you start to see a decline in your cognition and the early signs of mild cognitive impairment or dementia or Alzheimer's, then take steps, and overcome that, because
Mhm.
it is tragic. And, basically it's a very inhumane disease, because what drives us, the humanity, is, the relationships. And when you don't know your own family members, or it's tragic. And it's like the spirit is left. The body remains, but the spirit is left. And I think it's tragic. And, our goal is to eradicate human disease. I think, look, nitric oxide is not a silver bullet. It's not going to cure every disease on the face of the earth. But here's what I do believe: the body cannot and will not heal without nitric oxide. I think we can impact a lot of diseases simply by focusing on nitric oxide, giving nitric oxide as a therapy, improving the body's ability to make it on its own. But you still have to deal with toxin exposures. You still have to deal with nutrient deficiencies or hormone deficiencies, and address the basics of physiology. But you have to start with nitric oxide. It is the foundation for everything else, because no matter what you do, and I think this has been played out in conventional medicine, drug therapy hasn't cured a single disease in the history of mankind, right? Because we're never deficient in a synthetic compound that inhibits a biochemical reaction. So we have to eliminate toxins, restore missing nutrients, give the body what it needs, the body heals itself. And that's our goal. I spent 25 years in basic science research and biochemistry and physiology, trying to understand how the human body works, what goes wrong in certain diseases, and then how do you fix it? How do you address root cause? And again, nitric oxide is foundational for all of that, but it's not the only thing that we have to
Mhm.
focus on. It's the first thing we have to focus on. But in many cases, it may be the only thing. Like for ischemic heart disease, we're finding just giving nitric oxide, dilating the coronary arteries, you can relieve angina, no tolerance formation, and maybe that's sufficient. Alzheimer's, we're seeing remarkable effects. But again, if you've got heavy metals, mercury, lead, toxicity, probably won't be as effective as somebody who's free of those toxins.
Yeah. So it's like, cleanse the bad stuff, add in the good stuff, and then we'll see some magic happen. Would you recommend for the brain function component for someone, even like I'm 27, and obviously not having any brain issues at the moment, but would you recommend, just for people like me and people like that in the audience, just taking it, not necessarily even preventatively, but just for the optimization component?
Yeah, for sure. Look, there's only two people in the world who need nitric oxide. There's the people who are sick and want to get well. And there's the people who are well and don't want to get sick.
Mm.
If we lived in Eden or Utopia, where the foods we eat were replete in minerals, we lived in a non-toxic world, and our body could make sufficient nitric oxide on its own, then there's no need to supplement anything. But the truth is, we live in a very toxic world. The food we eat is depleted of most nutrients, and so we almost have to supplement. I'm 51, but I've been taking nitric oxide for probably 20 years, and it's not because I need it; it's because I don't want to need it.
Mm.
Because I'm on an airplane every week. I travel hundreds of thousands of miles every year. I'm in hotels in different parts of the world. I try to eat a good diet. I always work out no matter where I'm at, but we need help. And I take this daily supplement, and I don't have any issues, no blood pressure issues, no metabolic issues. My dad, on the other hand, my mom and dad been taking it for probably 20 years. My dad's paraplegic, diabetic. He's been in a wheelchair since 1984. Was on probably 10 or 12 different medications, high blood pressure, diabetes. And we started him on nitric oxide probably 15, 16 years ago. Got his blood pressure normalized, got his diabetes managed, even for a sedentary guy like that. So yeah, no, I recommend everybody take our nitric oxide, because if your body can't make it, we do it for you, but we're improving your body's ability to make it. So where you won't lose nitric oxide production with age, we're maintaining the function of the enzyme, because we're focusing on the oral microbiome. It's maintaining a good, healthy microbiome and improving nitric oxide through that pathway. So yeah, I think we have to be proactive and prophylactic in our approach.
Yeah, what I love about this is I know there are some supplements. I think glutathione would be an example where like you don't want to take it every day because your body becomes reliant and cannot produce it on its own. But what you're saying is like this not only adds it back in, but it actually improves your body's ability to produce it, which is so special and so unique. I'd be really curious, and maybe you can speak to this too. My biggest health goal right now is getting progesterone up. So I am chronically low in progesterone, have been for so many years. And it's hard for women. I see this a lot. We live in a world with xenoestrogens, these
Right.
microplastics, phthalates, like all these things that are attacking our hormones, right? And for me, one thing that I really want to focus on is fertility in the next year or so. And so I'm doing things like adding in phytoprogesterones. I'm taking DIM, trying to eliminate anything estrogenic in my diet and really get into like non-toxic clothing, right? Would something
Yes,
like nitric oxide support this journey?
for sure. So number one, nitric oxide improves sperm motility in the male, obviously, but it's part of, so estrogen and many hormones, sex hormones, there's a two-way street with nitric oxide. So most endocrine, in fact, I think all endocrine glands or organs are dependent upon nitric oxide for secretion of the hormones. And then things like estrogen and testosterone activate and stimulate nitric oxide production. And that's the reason estrogen and testosterone are cardioprotective, cytoprotective, because they're stimulating and activating nitric oxide production. Now, when people get into hormone imbalances, specifically women, then their nitric oxide production becomes, less, especially around perimenopause or menopause. Then their cardiovascular risk, goes way up. But no, I think again, it's very personalized. Yours may be progesterone related, others it may be estrogen, but it's a balance. Hormones are meant to be work in unison and similar to an orchestra. And so if one is off, others are going to be off. So you have to focus on optimizing that. And it's very difficult to find a really good informed endocrinologist, especially for women's health.
Mhm.
But no, so to answer your question, yeah, nitric oxide is extremely important because, again, you have to have a viable egg, you have to have viable sperm that meet, and then once it implants, you've got to have adequate blood flow to the placenta to deliver that nutrient to that growing embryo to support, the entire 9 months of gestation and growth.
So you can take it while pregnant as well?
Absolutely. My wife took it with our kids and it was completely fine.
Amazing. Okay, at this point, I'm sold. I'm like, you have convinced me on nitric oxide. This sounds like a really amazing treatment for everything across the board. And okay, one thing I really want to touch on with you while I have you is skincare. I saw you also have your, is it N101, like your skincare line. Can you tell me about the formation of this?
This, I never imagined I would be in skincare and beauty, but I think all things happen for a reason. And the impetus for this was my dad, who I think in 2014, being at that time 30 years in a wheelchair and developing pressure ulcers on his ischium, his cheekbones on his butt, developed these non-healing wounds. So he had developed a stage 4 non-healing ischial ulcer. I took him to all the wound care docs that I knew, and they said, you will never heal this wound in a 60-something-year-old paraplegic patient. And I just refused to accept that. He developed, sepsis, osteonecrosis, osteomyelitis. He almost died from the infection. And once we got him out of the hospital, I refused to allow this to continue. And so I started understanding that that wound was non-healing because it didn't have adequate blood supply. And without adequate blood supply, it's isolated from our immune response. So these bacteria grow and become infected. So I thought if I could deliver nitric oxide to that wound bed, I could increase blood flow to the wound bed and it could kill the bacteria. So I started developing a nitric oxide releasing gauze that I would do a wet to dry dressing every day that would release nitric oxide in the wound bed. And what I found within 10 days, this wound completely turned pink, started to granulate, started to close in, and we were seeing progress on a 4-year-old non-healing wound. I could start to see growth. The infection went away, and we healed this non-healing wound just by giving nitric oxide.
Wow.
Now, we started with nitric oxide. We did stem cells. We did ozone therapy. I did a number of things. But to make a long story short, we healed a 4-year-old non-healing wound in a period of less than 1 year using nitric oxide primarily. So then all these wound care docs, I took Dad to, said you would never heal this wound. When I healed it, I took him back to him and I go, see what we did? And their jaw dropped and they were like, what did you do? How did you do this? So then I felt I had an obligation and a responsibility to bring this to market. Now we're developing that as drug therapy. But, I thought, well, the skin is an organ, just like the brain and the heart and the sex organs. And people spend a lot of money on facelifts and procedures. And I thought people age and skin ages because lack of circulation. So I thought if I could develop a topical nitric oxide to restore blood flow to the skin, then we could improve circulation, oxygen delivery, we could mobilize stem cells, we could improve collagen deposition, maintain hydration, and fine lines and wrinkles would perhaps go away. So that was the genesis of our N101 nitric oxide activating serum. So again, nitric oxide is a gas, so we had to develop a dual chamber. You take one pump from each side, you mix it together, and then when you apply it to the skin, it releases nitric oxide gas. And so you can see your skin turn a pink. So we're improving blood flow and oxygenation. And now I think we've got 5 published peer-reviewed clinical trials on the serum. Fine lines and wrinkles are improved, I think by 87% in 30 days. Tone, texture, clarity of the skin is improved. We improve collagen deposition, hydration. I mean, it's amazing product. In fact, it's probably the best non-surgical facelift product on the market. And we've got a number of med spas using it, plastic surgeons, dermatologists. It's a remarkable, one-of-a-kind product for skincare and beauty.
I want to try this so badly. It sounds incredible. That is, I mean, I'm the kind of person where like I'm very into like my non-toxic everything, right? But like so I don't get any of like the injectables or things like that, but I'm all about like a laser or, like holistic facials, all those things. I will spend so much money on treatments for my skin to holistically treat it. I'm like, "Wait, this sounds amazing." Do you recommend it even like preventatively for younger? I mean, speaking to women, but men and women. I mean, you're a man, you develop this, and men need to prioritize their skin as well. Do you recommend like using this preventatively to even like prevent those wrinkles and loss of collagen from happening in the first place?
Yeah, no doubt. I've developed this product, I guess, 6 years ago. Prior to that, I've never used a skincare product my entire life. So I was a little bit behind the 8 ball when I started. But no, I think what we're finding is the earlier you start, because we have to nourish the skin, we have to oxygenate the skin. what we're finding is nitric oxide is the signal that tells our own stem cells to mobilize and differentiate. And the dermal cells, we lose cells on the skin, exfoliation, every day. So we have to replace those with cells that work properly. And part of that is dependent upon adequate blood supply, mobilization of stem cells, um, and so to improve cellular turnover. So yeah, the earlier you can start as a preventative. I only use it once a day, at night, because it's not part of it hadn't been part of my daily routine for 40 something years. But at night before I go to bed, I apply it. The clinical trials that we've done is using the serum once in the morning and once in the evening, so twice a day. So I could probably do better by incorporating it in the morning and the evening as our clinical trials suggested. But yeah, you can do it. I think it's best, again, this whole philosophy of being proactive and prophylactic rather than reactive is the best approach.
That's incredible. Okay, this is like so mind-blowing. Where do people get this serum and like all of your skincare products?
Well, our product page is n101.com. That's the letter N, number one, the letter O, number one, .com. All of our nitric oxide products there, the toothpaste, the supplements, the pre-workout, the bead powder, and the entire skincare line of products. But yeah, so and then we'll create a coupon code for your listeners here so they can get a discount if they're interested in the products. But my main motivator is education and awareness, and providing real science on product technology and the importance of nitric oxide. So really, I encourage people to subscribe to my YouTube channel, Dr. Nathan S. Bryan, Nitric Oxide. Follow me on social media, Instagram, Dr. Nathan S. Bryan, LinkedIn, Twitter, I'm Dr. Nitric. And then I'm searchable on most search engines.
Amazing. We'll answer the question of where to find you. And yeah, if you're listening, we'll make sure to put that discount in the show notes so that it's super easy for you to get. If you're like me and your mind is just blown by the power of nitric oxide and you're like, wait, I have to try this, make sure you use that discount. And then I do have to ask you before we close, I love to ask everyone because I think it really does bring a level of humanity to the experts where we can often put these experts on a pedestal, right? And forget that everyone's working on something in their own health. What is your biggest wellness goal right now?
Really, it's to live as long as I can free of disease. That's my goal. I listen to my body. Our body talks to us all the time. And, the people who are receptive and listen to it and make changes based on how you feel and how your body's talking to you, and it's not just for me, it's for my kids and family so that everybody can adopt these very simple principles, because our greatest asset is our health. I mean, we can't enjoy life if we're sick. People have many, many goals and ambitions when you're healthy. When you're sick, you only have one goal, and that's to get well. And so my goal is to live as long as I can free of disease and, leave the world a better place and leave a legacy. And if we're sick and we can't think, we're not productive. And so I think we have to maintain our health. It's our greatest asset so we can, serve others. I think we're here to serve others, live with a servant's heart, and do the best we can and leave the world a better place.
That's absolutely beautiful. I love that goal, and I think it's so true. I mean, I think our society really could do with shifting from this I'm sick, X, Y, and Z is going wrong, I need to get better to like before the onset of sickness and disease and illness, like let's optimize our health. Let's promote our health so that we don't even run into those issues in the long run because
Sure.
that's the best way to live. Sometimes we forget that that's available to us. So it's so important to remember that that is available. It just takes curiosity and consistency and the right information.
And
Well, Doc,
discipline. It takes discipline. it's
absolutely.
hard. It's hard work staying healthy, but it's harder work getting healthy if you get sick. So if I'm going to work hard no matter what, I would rather work hard staying healthy than trying to get healthy if I'm sick.
Amen to that 1000%. And it's so much easier when you build those habits, it's hard at first, maybe the first year or so, but then once you build habits, it just becomes second nature.
Yeah,
And
pays dividends.
yeah, so it's a beautiful way to live. Well, Dr. Nathan, thank you so much. I have learned so much today. I know the audience is going to learn so much as well. I've really appreciated you taking this past hour to chat with me and educate all of us on nitric oxide and everything you're doing. If you guys are listening, make sure to check out Dr. Nathan's social media. listen to everything he's doing. He puts out really amazing educational content that I am absolutely eating up. So make sure to check him out and check out his product page as well. Thank you so much for listening, you guys. I hope you have a wonderful rest of your day.
Thank you, Delaney.